everyone, I'm Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. I'm a board certified OBGYN and I'm a certified nutrition network practitioner. In today's video, we're going to be discussing the question of whether menopause hormone replacement therapy is right for a woman. And really, I know you want to know if bioidentical hormone therapy is the right fit. Stay till the end because I'll offer tips and strategies for you so that you can have a really great knowledgeable conversation with your healthcare provider on menopause hormone therapy and whether it's right for you. So let's get to it. Menopause transition, this time in a woman's life, can be a transition in our life that actually lasts for about 10 years. Now, the average age of menopause is 51, but the symptoms related to menopause can last for about 10 years, even before menopause truly happens. Now, menopause is when you have no period for 12 months, but a lot of the symptoms that can happen before, hot flashes, anxiety, depression, short-tempered, irritability, joint pain, insomnia, all of those things can come and go for several years before the actual 12 months of no menstruation would occur. And it's really hard for a lot of women. So many women are suffering silently and they're really just looking for some validation. A lot of people will invalidate women. A lot of people will tell them, oh, you're just too stressed or anxious. And really, sometimes it's because they're going through the menopause transition. And so, yeah, there might be a 49-year-old woman with hot flashes and had her last menstrual period about 3 months ago. That might be in this transition phase. There might be a 52-year-old woman who hasn't had a period for 14 months and is really struggling with anxiety, insomnia, and hot flashes too. So this perimenopause, this menopause transition, and menopause is real. And my job is to help bring understanding to all of us women to really validate what's going on. So menopause hormone replacement therapy, actually the term is menopause hormone therapy, which is hard for me because I want to still call it hormone replacement therapy. But this therapy is actually a supplementation of estrogen or progesterone or both to stabilize some of those side effects related to the menopause transition. It is really helpful for vasomotor symptoms, which is hot flashes. It's genital urinary syndrome of menopause, which is that vaginal and vulvar dryness that a lot of us experience. It's for the prevention of osteoporosis, and it's also indicated for women who had early menopause or premature ovarian failure. Now, what's really going on? So when women get through into that menopause transition, the perimenopause phase of life, what is going on naturally is there is a huge shift towards insulin resistance. Now, insulin resistance is your body is having a harder time processing sugar. It's requiring more and more insulin to process the glucose and the carbohydrates that you're taking in. And a lot of that insulin resistance leads to inflammation and weight gain. That's a natural phenomenon that happens in the perimenopause transition, which is why it's really hard for women to lose weight during that time. When we experience insulin resistance, that's actually directly related to the declining estrogen that's happening in our system because our ovaries are producing less and less estrogen. When we're producing less and less estrogen, our fatty tissue from our hips and our thighs shift towards our abdomen, and that abdominal fat also contributes to the insulin resistance that we're noticing in perimenopause. And so that's really one of the main reasons why women are experiencing a lot of the vasomotor symptoms, a lot of the difficulty with weight loss during the perimenopause and menopause transition. I'm going to get to the treatment. Before I do, if you're liking this video, please like, please share, please subscribe, hit the notification button. Actually, just write a comment saying, hey, thanks for writing this. As you know, so many of us are suffering silently, and the more you interact and helps other women get to this vital information so that they're not alone in this transition. So when we talk about treatment of menopause symptoms, by and large, the menopause hormone therapy is focused on vasomotor symptoms of menopause, the hot flashes, okay? And there's two major medications or treatment options that we give to women: bioidentical and synthetic. Okay. And the great news is that the majority of the menopause societies out there are really advocating for bioidentical hormone replacement therapy. And that's really great because bioidentical hormone replacement therapy actually are the hormones that our ovaries produced, and they're the exact same ones that under a microscope would be the same that our ovaries would have produced for us. And so the preferred option is estrogen, which is estradiol, and micronized progesterone. Okay, and those are the two formulations that your ovaries produce to help you with your menstruation and what made you feel kind of like a woman. They come in patches and pills and gels and creams. They are actually better and more preferred to the synthetic options because they have less risk of thrombus or blood clots, and they have less triglyceride effect, so they will cause less elevations in your triglycerides. They actually decrease the amount of inflammatory molecules like CRP, and they have less effect on sex hormone binding globulin and other clotting factors. So bioidentical hormone replacement therapy that we see in patches and capsules of estrogen and progesterone are the preferred modality. There are other options that are synthetic, which you might have heard of, which are the conjugated equine estrogens like Premarin, like medroxyprogesterone acetate, Provera, norethindrone. Those are all of the synthetic hormones that are actually also very good as well, but they are associated with a higher risk profile. That some of the concerns that we saw in the Women's Health Initiative back in the early 2000s were all based on synthetic hormone therapy and not the bioidentical hormone therapy that the majority of our menopause societies are moving towards, which is really great. So the interesting thing is that menopause hormone therapy is actually for a subset of people, but there are some people who actually should not be on menopause hormone therapy. And these are women who have ever had a history of a heart attack or a stroke, who've ever had any hormone sensitive cancers like breast or uterine cancer, or a history of a thrombus or a higher risk history of a thrombus because of some genetic factors that they carry, if they have really active liver disease, or any unexplained vaginal bleeding. Now, this video is not medical advice, so you really do need to talk with your healthcare provider to assess your total risk evaluation before you start menopause hormone replacement therapy. But by and large, those are the folks that should not be on any kind of hormone replacement therapy for natural menopause. Now, what's going on with compounded hormone therapy? You've probably heard a lot of people who use pellets or other kinds of gels and creams that are based on from compounding pharmacies. Now, they're really helpful for people who are maybe allergic to some of the stabilizers that are in some of our FDA-approved estradiol, micronized progesterone capsules. But a lot of times the dosing can be invariable. Some from batch to batch, the doses can be a little bit different, and so it's really hard to get like a stable dose that what a lot of women need. And sometimes too much of a good thing can actually lead to a lot of conversion of, let's say, estrogen, testosterone to estrogen that increases a woman's risk for hormone-sensitive cancers. So you really have to be careful. Compounding pharmacies are actually really great, but there are very few regulatory bodies that are monitoring, and there's no place to address adverse concerns that are related to a lot of these compounding pharmacies. And so really what women are looking for is natural therapies, and we have plenty of FDA-approved bioidentical hormone replacement therapies that are actually exactly the same that what our body used to make or has started to decline making. And really what we do want is treatment of symptoms, right? And so many of us healthcare providers have no problems with like increasing or decreasing dosing based on how a woman is feeling. And we don't have to worry about checking hormone levels or anything like that for women in that perimenopause or menopause state, because we already know a woman is telling us she's having vasomotor symptoms, brain fog, those kinds of things that are related to the transition, and we should treat the symptoms and not a number. Now, let's create a plan, okay? So if a woman is having perimenopause or menopause symptoms, really what we should do instead of just reaching for medications is try to address the problem naturally with lifestyle changes like a low carb, high fat diet, increasing our exercise, because if we exercise, we're going to increase muscle mass. And muscle mass is really where our glucose gets stored in the form of glycogen. It helps reduce our risk for insulin resistance. And then if those kinds of things aren't getting better, if we're improving our sleep hygiene and our sleep is still not getting better, then maybe we can consider hormone replacement therapy to treat our vasomotor symptoms that can lead to insomnia. And that hormone replacement therapy can be very beneficial. And there's plenty of bioidentical, FDA approved hormone replacement, menopause replacement therapies that can help women. My challenge to you is if you're experiencing these problems, consider a low carb, high fat diet for 2 weeks. Track your sleep, track if you're losing or gaining weight with this lifestyle change, and then let me know how it goes. If your symptoms are not improving, then consider seeing your healthcare provider to talk about menopause hormone therapies, to discuss or to actually address some of the symptoms that you might be experiencing. You might be a really great candidate. And what the data shows is only 5 to 6% of women out there who have menopause symptoms are actually on treatment. And that's not okay. We really do need to help women through this transition. There's so many safe therapies. And so if you're really interested in looking at that, there is help. I can help. You can check out my YouTube channel. You can check out some resources I have in the show notes about bioidentical hormone therapy from some really great menopause societies that will help. But I would really also recommend that you see a certified menopause practitioner so that they can help you through this transition. If you're interested in a consultation, check out consciousgynecology.com and I'll be able to help you. My personal mobile phone number is there, and as well as my email address and a way to make an appointment. I would love to help you through your specifics of your journey. Thank you so much for watching this video, and I'll see you at the next one.